Vision Acupuncture. One of the services we offer here is to treat dry eye. Dry eye affects around about 30% of the population and can be a really debilitating condition. So we offer treatment that ranges from quite mild cases right through to really severe cases, and looking at a variety of causations. So at a very basic level, we look at dry eye as being a dysfunction that affects the production of some of the lubricating factors. Acute and chronic conditions which can affect how your tear film is produced. These can include systemic conditions, so any medical condition that you may have that's affecting multiple body organs or body systems, as well as the medications that are used to treat some medical disorders, can all influence how dry eye is produced in your body. We also understand that allergies and inflammation in different areas of your body might be a contributing factor for dry eye, and sometimes we even look at lifestyle factors. So each person that comes to us with dry eye has individual factors that might be causing their dry eye. And what we look at when we're trying to determine what happens on an integrative level is how other things in the environment or in your lifestyle that you may not have considered will be affecting the presentation of your dry eye. So what we have here in our little bubbles is that we're looking at drivers that might affect the whole body, but also then affect the eye and its overall health. So things like high blood pressure will affect the body on an overall systemic level and will then affect what happens in the eye itself. We also have here medication, and medication for things like blood pressure, but also other disorders, can influence the whole body again and overall eye health. You may have heard about the role of genetics in overall health, and this is a factor that we consider in eye health. It can cause and be a contributor to some eye diseases, and in an overall level in terms of dry eye, we look at how it might interact with some of the other factors that we have on the board as well. So genetics can be a direct influence on you and your whole body, and therefore your eye health, but it can intervene or interact within the environment particularly. So a lot of the time with genes, we talk about there being an environmental trigger for their expression. On a nutritional level, certainly what we put in our body will always influence our overall health. So from nutrition, we look at our whole body and its experience of health, and that obviously will feed back into what's going on with our eyes. And the very same nutrients that we talk about in terms of being absorbed and from our digestive tract and being involved in our eye health will also be required for great eye function and lubrication in dry eye. Within this, we also see lifestyle. Many of us work long hours and have high stress, and so this becomes a driving factor as well. It might influence how you eat or whether you eat well and frequently. So this becomes an influencing factor for our overall health and certainly our overall eye health. The environment can have a huge influence on our eyes as well. If you spend all day in an air-conditioned environment, or if you live in a cold climate where you need a heater on all day, this can certainly affect the lubrication of our eyes and how our tear film is produced. The same goes for allergy. It can affect us on a systemic level, so looking at our whole body, and it can also have a direct effect on our eye in terms of inflammation and redness. Another influencing factor would be how you use your eyes. So we have activities like looking at a screen for long hours in a day, which will change how frequently you blink. So this can be a direct influence on dry eye. And also if you use contact lenses, that will change how you produce tear film in a day and can lead to dry eye as well. Finally, here we have surgery. If you've had to have an intervention for your eyes, this can certainly affect your eyes directly. And while surgery might be necessary for some conditions, it can result in dry eye. So we try and look at that as well in our overall approach. Currently, the primary therapy for dry eye is eye drops, which offers temporary relief for the symptoms of dry eye. A recent study concluded that acupuncture is more effective than eye drops for dry eye syndrome. In Oriental medicine, the cause of dry eye varies according to each person due to their specific underlying disharmony, which may be combined with or exacerbated by external influencing factors. Our Vision Acupuncture practitioners take the time to thoroughly assess your case to determine contributing factors and recommend personalised treatment approaches. An initial consultation will include health assessment, ophthalmic and general health history, lifestyle and nutrition assessment. The range of integrative eye health services considered for our clients include traditional Chinese and Japanese medicine, acupuncture, moxibustion, microacupuncture systems, electroacupuncture, Chinese diet therapy, naturopathic medicine, supplement and lifestyle advice, food or allergy testing. Sometimes dry eye is associated with other conditions like red eyes or itchy eyes or having eye fatigue. And with our integrated treatment approaches, we can also address these contributing factors. Overall, once we've identified some of your driving factors for your dry eye, we come together and create a treatment approach that looks at the cellular health of your eyes, but also the things that are underpinning it, so the causation of your dry eye. So we're not just treating your eye, we're also looking at what your other factors might be. So my role as a naturopath, I will look at things like digestive health and assimilation of nutrients, whereas the acupuncture will look at blood supply and how those nutrients are actually delivered to the eye. This integrated treatment approach can bring about a relief and resolution of your dry eye because it considers all of the factors underpinning it. Because there are so many causes to dry eye and you might be at a different stage of treatment to the next person, we do encourage you to contact us here at Vision Acupuncture to assess if you're a suitable candidate for our treatment intervention.